I'm Megan from Ormon Fitness, and in this video we're going to talk about knee squats. So this is a good exercise or movement pattern to practice if you are early postpartum, or if you're dealing with any core or pelvic floor dysfunctions and are still trying to connect to your core and pelvic floor through movement, things that you do in activities of daily living, or if regular squats give you trouble in your knees. This is a good exercise to practice as well. It's the same movement pattern as squats when you're standing up, except it takes some of the pressure off of your knees and helps you learn how to hinge your hips back. So what we're going to do is you can use weights or not use weights in the beginning. If you're first practicing this exercise, I would not recommend you using weights, and as you get better at it, then add some dumbbells up on your shoulders. You can add a weighted ball. You can add your child once you get good at it. Or even if you're practicing picking up your kid from the floor in early postpartum, learning how to do it in a helpful manner will be beneficial to you. So you will use that weight if you have one. If you're just starting, then don't worry about it. But you're going to sit back on your heels and take a nice deep inhale. On that exhale, you're going to press into your knees and squeeze your glutes to get you upright. So it's going to look like this. Notice as I'm doing this, I'm practicing my connection breath as well. So I'm exhaling, gentle lift through my pelvic floor, connecting to my core, just gently. As you're increasing the load, increasing the weight, increasing the repetitions, you might have to increase your pelvic floor contraction to meet the demand of the load that you're using. But this is a rather easy weight for me to kind of throw around, so I'm not going to be engaging my pelvic floor and my core a lot to do this movement. Now, if I was using a heavier weighted ball, if I was using my toddler, then the pelvic floor contraction might be greater in this movement. So let me let you see what this looks like from the side. Again, squeezing those glutes. And again, when this becomes easy for you, you can increase the load. You can move into standing squats as well. So remember that this is the movement pattern that you want to do in squats when you're standing as well. You want to hinge those hips back and bring them up. When you're even in that standing position for squats, we're hinging the hips back and standing. Same movement pattern, maybe a little bit less pressure on your knees. Good luck, guys.